Cool. So we're just gonna wait a minute for folks to come in. Anybody else in the waiting room? Okay. All right. With that, good afternoon, everybody. Good evening, I should say. We're already there. My name is Hayley Thompson. I am a professor in the Department of Oncology here at Wayne State University School of Medicine, and I also am the Associate Center Director for Community Outreach and Engagement for Karmanos Cancer Institute. So thank you for joining us today. This is actually a talk that I started about 2 weeks ago, and we were interrupted because of a fire alarm in the building. So this is our time to kind of finish that talk up. So I am going to be starting from the beginning. I'm not going from where we left off because I know there may be some new people on the call, on the Zoom meeting, but I will go through the first part of this, pretty quickly, because it may be a repeat of information. I am going to also take some time, or we're going to take some time to review some things that have been happening at the federal level just to provide information around research and some changes that could affect or that would affect the way we work if they stand. So I'm going to keep going ahead. Is that okay, everybody? Good. I think we're some people are trickling in, but I'm going to get started. Okay, so just an overview of Karmanos Cancer Institute. We are what's called a National Cancer Institute, or NCI, designated comprehensive cancer center. And they're only, again, I got to change that number, about 56 or 57 in the nation. It's increased over the past few years. But there are fewer than 60 across the country, and there are only two in the state of Michigan. That's Karmanos Cancer Institute and Rogel Cancer Center, uh, which is part of University of Michigan, near Ann Arbor. Okay, and so it's considered prestigious to have this designation because not everyone has it. There are a lot of institutions that want this designation, but it really is provided or given because of not only high quality cancer care, but because of the breadth and depth of research, right? Research is what drives cancer treatment, whether it be direct treatment for the disease or improvements to quality of life for not only cancer patients and survivors, but caregivers and communities. So I always like to go through this. That designation is given based on an evaluation of all of our research programs and the way our cancer center runs in general. And we're reviewed every 5 years by the National Cancer Institute. So that's really important. Every 5 years, we get reviewed for the work that we do, particularly our research, right? And that's part of what we call a Cancer Center Support Grant. Right? It's P30. You can go look this up and Google it and find all the parts and all the components that need to be part of a comprehensive cancer center. It's public information. So that is there. And I will say that it also comes with millions of dollars, right? These dollars, again, help support our research enterprise, including our clinical trials. I also add that in addition to the 5-year review, we also have an external advisory board that reviews us every year. So these are experts from around the country who usually have leadership roles in their own cancer centers. And every year they come and they see our progress, and which is really important because it prepares us for the big 5-year review. So again, so if anybody has any questions, do we have the Q&A open? I know we had that last time, or people can put questions in the chat. Yeah, please put questions in the chat and I'll ask my team to let me know if there are questions in the chat that I need to answer. Or you can raise your hand or whatever you need to do. So because I've given you this whole piece, I want to take a little break here. So let me say the National Cancer Institute is part of the National Institutes of Health. And you all tell me, okay. Everybody good? You can see where I was before? Okay. So I'm getting moving again. If you have any questions, my team will be looking at the questions there and I'll answer them as best as I can. So again, I oversee community outreach and engagement at our cancer center because this is like about 2017, 16 or 17. The NCI began to acknowledge that cancer centers need to be committed to community outreach and engagement because in working with communities, cancer centers can have a profound impact on cancer burden in our catchment area. And a catchment area, all that means, all that represents are the communities we serve, right? The neighborhoods, the regions, the cities, the counties that we serve. So that became something more strongly emphasized across all comprehensive cancer centers through the NCI. So that's why I do the work I do, and we have our team, our Office of Community Outreach and Engagement. I'm going to skip this for now. So here, actually, so remember I told you that we get our designation through a grant, right? From that we get from the National Cancer Institute. So you always have to write a proposal for a grant or renew it, your information. So we have to have aims that we write up as part of a research plan, and our CCSG stands for Cancer Center Support Grant. These are actually our official aims, right? We want to monitor the cancer burden and disparities and needs throughout the Karmanos KCI, that's what we call Karmanos Cancer Institute, the KCI catchment area. We want to build capacity for community academic partnership in all phases of cancer research and cancer control efforts. A lot of you are part of those community academic partnerships. I know there are a lot of Cancer Action Council members and folks involved with other networks that are on the call. That's what that means and refers to. The third aim is to inform the development and implementation of basic, clinical, and population-based research that is responsive to catchment area and community stakeholder priorities. So again, that means that, our work here at Karmanos has to really reflect the needs and what's important in our communities, our catchment area. And finally, we're here to promote and implement strategies and policies to reduce cancer burden in our KCI catchment area. We want to reduce the suffering of cancer. Okay, so our office has the primary responsibility for community outreach and engagement. It's reflected in our name, and we make sure that the science and the programming here at Karmanos is aligned with our catchment area needs, again, to reduce cancer burden. We were established in 2017. I've had this role since 2018, and you can find a lot more information about us on our website, on Karmanos. We're very easy to find if you kind of just Google around and search the website, and it's usually on a lot of our materials. So actually, over the past year or so, our office now has 4 sections, and these are the 4 sections. And I'll talk about through each of them. You'll see examples of what we do. But there's catchment area data and responsive programs, right? Because we collect data from around the state and from other sources to understand our catchment area. Scientific engagement and capacity building. So that's how we connect our scientists and our communities. Cancer prevention, screening, and connection to care, right? That's a newer one that's evolved because we're doing a lot more to make sure that we identify people who need care and making sure that they get the care that they need, particularly when it comes to cancer screening. And the fourth area is partnerships and policy. And you'll see what that means has to do with the partnerships we form with different organizations throughout the state and throughout our catchment area. And we're working on different policy efforts with different coalitions in different settings. Okay. So this is a little bit about our organizational structure. Again, I'm the Associate Center Director, so I report to the Deputy Director of the Cancer Center and the Director. Those are the 2 people I report to. We are actually trying to hire an assistant director who will help support our work. And then many of you know Brittany Dow. She couldn't be here today. She's off today, but she's the director of our office. We also have uh, uh, managers for many of our sections. As you can see here, I want to acknowledge Maida Herrera, who's on the call, who oversees partnerships and policy. I'm not sure if Madison Pavlasak is on the call, but she oversees cancer prevention, screening, and connection to care. But we have a number of people, and our team is growing somewhat so that we can get all this work done across the state. And I think another thing I'll mention here, yeah. So I'll mention that our office historically has been underfunded. I know that a lot of people want us to do a lot of different things, and we really actually only until recently had the budget to do much more, again, on the scale that we need to do it on across the state. So that's only as of this past October do we actually have funds to do some to have more impact, I should say. So I want to point that out. Also want to talk about McLaren Hospital. So we are, and I'm going to mention this again, we are the cancer care arm or the oncology line for McLaren Healthcare, which has hospitals all across the state. So that we became actually that part of the hospital, right, became a subsidiary of McLaren Healthcare back in 2014. And right now we have 17 cancer care sites across the state because of the connection with McLaren Healthcare. I should say that there is a distinction between the Cancer Center Support Grant and the research arm and Karmanos as a hospital along with McLaren, right? We work closely together, but they're separate. So my team and I, we're Wayne State University employees, but they're people that you will encounter who are McLaren, obviously, and Karmanos employees. So it's a little confusing, but that is just, again, something to be aware of. And here's our executive community advisory board. We're actually expanding the board and bringing in some new folks and making it larger and even more comprehensive. But we're really grateful to these leaders across the community for supporting our work and advising us and guiding us. Yeah. We have a whole logic. I'm not going to get into this. We have a whole logic model that guides kind of the work that we do and moves us towards the impact that we want to have. So this is just for your awareness. For those of you who have that background and aware of logic models and their importance in having impact, just know that we have one. Okay, so I'm going to talk through our different sections right now. Are there any questions or anything that's come up in the chat or anything that I can respond to?
There's
Somebody might have to read it to me.
there's one question, Hayley.
Okay.
Are the data collection and reporting limitations being put on the CDC affecting your work?
Not yet, because it's at the CDC. So this work is not really, again, and that's a great question. So right now, uh, and there are different things that are happening across all federal agencies, right? We know that there's a lot of activity around things that are considered DEIA, diversity, equity, inclusion, and accessibility, right? But in terms of NIH and any directives to make specific changes, that has not happened yet. So everybody's in a very much a wait and see mode. But many of us are not changing anything until we are told we have to change it. Okay, so first, catchment area data and responsive programs. So let's talk a little bit about this. As I mentioned, Karmanos is connected to McLaren Healthcare. We actually talk about a whole Karmanos Cancer Network. On the map, you can see all the different cancer care sites going from Detroit, which again, we usually say that Karmanos is headquartered in Detroit. But again, now we're all around the state, going all the way up to Petoskey. Technically, we're actually in Ohio too, but we don't, that's not a part of, we're not making Ohio part of our catchment area yet. 95% of our patients come from the 46 counties in our catchment area, the eastern half of the state. And you can see that we have 5 regions right in this catchment area. Detroit is its own region. There's a southeast region, east, right? The green area in the thumb, central in the red, and then the purple is on the north, right? At the top. And we actually serve 31%. So a third of new cancer patients in the catchment area are treated by Karmanos/McLaren. So it's a lot of folks. At one point, we were saying, I'm not sure what it means now, given some of the Corewell changes of Corewell and other systems. At one point, we were the largest cancer care and cancer research network in the state. And a lot of this you can find online, and we'll share this parts of this deck. We'll try to make it available on our website. So again, part of what we have to do is get data to understand our catchment area. So in those 46 counties and 5 regions, we have 6.8 million residents. That's who we cover. And there are about 10 million residents in the state of Michigan. And again, 95, these 46 counties represent our home to 95% of the patients treated at our KCI sites, our Karmanos sites. And then you can see some changes on the right in terms of the populations across our catchment area. Again, this is really important for us to track, especially when we think about disparities and unequal care or unequal access to care and disparate cancer outcomes. So you can see our different racial and ethnic groups. I would point out that you can see that if you go, particularly when you look at Black populations and white populations, it really shifts as you move further north, right? Demographics change a lot. But also notice at the end, we focus on rural populations. We always have, right? Especially when we expanded through McLaren. And you can see as you move further, went to central Michigan and northern Michigan, if you look at the bottom 2 rows, that those populations increase, right? The number of rural residents. And also we track those who are living in poverty. and that number, the proportion of folks living in poverty is higher in Detroit compared to the other groups. But again, this is information, and we're actually updating we've been updating our data for our website. So that's going to return, all this is going to return to our website hopefully in the next 2 to 3 weeks. And they'll be there because we want everybody to have access to this information. Oh, and this is just an example. We identify rural areas and rural residents by something called rural urban continuum codes, or RUC codes. So, and they go from 1 to 9, with 1 being the most urban and 9 being the most rural. Again, you can see how the changes as you move further north in the state, which is probably nothing new to anybody who was born and raised in Michigan. So again, we track cancer burden, incidence, and mortality. You can see, and here, if you look, top incidence are new cancers, mortality or cancer deaths. When we look at the leading 4 cancers on top, those are the leading 4 cancers at most cancer centers in most catchment areas because they're the leading cancers in the whole country: breast, prostate, lung, and colon cancer. And you can see that for prostate and lung cancer, their incidence rates are higher, significantly higher compared to the rest of the United States. Right. Also, there are some more rare cancers that are higher in our catchment area, where incidence, I should say, is higher in a catchment area. That's bladder cancer and pancreatic cancer. And then we look at mortality. You can see that for prostate, lung, and pancreatic cancer, our mortality rates are also significantly higher. We also track cancer disparities and incidence and mortality. So you can see here across, we're looking at, here we're featuring Black residents, Native American or Indigenous residents, Hispanic, Latino residents, and rural residents. So the green bar, anytime you see green, that means there's no difference, or the rates are lower or significantly lower than the reference group. For the different racial and ethnic groups, the reference groups are white residents, and for the rural group, the reference group are non-rural or metropolitan or urban residents, right? So you can see here, what's particularly striking here is that with incidence, you can see that for Indigenous people and for Black residents, incidence for many cancers is higher compared to white residents, right? And we also see that for lung cancer, it's higher among rural residents compared to urban residents. And then when you look at mortality, it's quite striking that mortality for most of these, all these cancers is higher, and in most cases, significantly higher among Black residents compared to whites. And similarly, you see that for rural residents, lung cancer mortality is also higher. So again, we are always working with these data, thinking about new ways to present these data, trying to keep the data updated. And again, we'll be sharing this with everyone. It'll come. These are all been online, but they'll be back online soon. Also, we track cancer risk factors and screening. So again, you can see when we look at cigarette smoking, you can see differences from the catchment area and the 5 regions: Detroit, the Southeast region, East, Central, and North. Right. So we can see some differences in Detroit when it comes to higher rates of cigarette smoking or being a former smoker, which is important to know for lung cancer screening now that that's available. We also see that for no physical activity in the past month, they're higher, significantly higher in Detroit and the Eastern region compared to the catchment area as a whole. Right. Also for former smoking, higher in the Northern region compared to the catchment area as a whole. Um, oh, I apologize. Being a former smoker actually is lower in Detroit versus the catchment area as a whole. Sorry about that. And then screening, certain screening rates, we're actually doing a deeper dive into this because I always wonder about these mammography screening rates, what you see at the top here. This first one ever had a mammogram. Across the board, they're quite high. That's from a behavioral risk factor surveillance system that they're quite high across the region. So we want to do a deeper dive into this because anecdotally in what we see in the community, there are a lot of people who are not on schedule for their mammograms. And similarly for colonoscopies or colon cancer screening, but you can see for PSA tests, it's pretty fairly low across the board. So again, this is an example of the kind of data we look at, and this helps to guide our work and how we focus our efforts and how we spend our budget as well. So even that we have a lot of sources of data at the state level, and we gather a lot of data to describe and characterize our regions and our catchment area, but we also go directly to our community, right? So our Michigan Cancer Health Link Cancer Action Councils have been an important way that we understand across different specific neighborhoods or communities or even populations what is important to people, to cancer survivors, to cancer caregivers, and to advocates who want to make a difference in this area. So right now we've been sunsetting some of the councils. We've gone from 11 to 8 that you see here. But across our community stakeholders, and across these cancer action councils, you can see some of the priorities that stand, like cancer caregiving. And some of these cut across different councils, right, and different groups. Digital inclusion and the digital divide, especially among older cancer survivors. Family history, genetic risk of cancer, and precision oncology. Lung cancer, smoking cessation or quitting smoking, and lung cancer screening. Prostate cancer, and always the financial burden and the costs of cancer care is huge for our community members. So we take that all into account when we share this with our cancer center and help to guide our cancer center's work. Any questions, any comments?
Katie, there is one question.
Mm-hmm.
Question is any of the worry about finances being caused by the discovery of involvement with China that may or may not have been publicly known? Sorry, but as a journalist, they receive press blasts about various issues, and they know universities are under the microscope now.
I would not be able to speak to that at all. I don't know.
Okay.
Sorry, I have, that's beyond my area of knowledge and expertise.
Those are all the questions. They're
Okay,
done.
cool. So, I also want to talk about responsive programs. So I want to acknowledge the Karmanos Cancer Advocacy Program, the KCAP. You know, the KCAP started in 2018, but before it was KCAP and covering all cancers, it used to be the PCAP, the Prostate Cancer Advocacy Program. And I know many of you know Dr. Elizabeth Heath, who was one of our oncologists here. She's now at Mayo Clinic. She left the institution, but she is the person who really, you know, helped to found this group and move it forward from since 2010. But ever since 2010, this group has had some form of a educational cancer symposium that was free to the public. I think the last time it was held, it was at Motor City Casino. But it was all every year. It's really well attended by folks from across the region to learn more about the latest in cancer treatment and cancer care. So we kind of, when Dr. Heath left our office and inherited this group. But, you know, as I've been trying to kind of communicate and hopefully what you're getting and what I want to really, what one of the take home messages of this whole talk is that, you know, the work that we do as an Office of Community Outreach Engagement is very much guided by the National Cancer Institute. And we have kind of different areas that we need to cover um, and certain responsibilities that we need to fulfill, right? So we need to make sure that everything we do is justified within these expectations, right? Because if we don't do our job as an Office of Community Outreach and Engagement, it's going to hurt our chances of getting a good score, our whole cancer center's chances of getting a strong score when it's reviewed every 5 years, you know, by the National Cancer Institute. So, you know, one of the reasons I wanted to do this talk was to kind of show you where we're doing now, what we're doing now, the directions we're taking now and why we're taking these directions. So um, there was not a symposium in 2024. You know, that's when the transition from Dr. Heath to our office kind of came about. We're not going to be doing it for 2025, in part because when thinking about our budget and how we have to spend our dollars, we need to direct those dollars in other ways to make sure that we meet all the criteria for the Cancer Center Support Grant. Now, does that mean that we're going to stop the work in terms of communicating new information about treatment and care? Absolutely not. You know, in fact, we are reviving, trying to strengthen our community conversations on cancer, and we want to have a section that's focused on cancer treatment. And we want to have those recordings of those sessions on an online archive that anyone can access at any time. And I think I mentioned this the last time I gave this talk. The last time we had this summit in person at the casino, I remember somebody stood up and said, "This is such great information. I wish I had it when my mother was diagnosed." Right. So, can we think about this really, really important information about treatment and care and think about packaging it in a way that people can access at any time, especially the times that they need it the most? I will say this one, I think it's okay to say that we're signing off on a really exciting new partnership with the Detroit Public Library. So now we're going to be doing our community conversations on cancer in partnership and over at the Detroit Public Library, right here in Midtown, which is near the university. So I think that's a really going to be awesome in terms of expanding the audience of people who has access to this information. And as usual, all our community conversations on cancer are we like them to be moderated by you all, by members of our community, by community stakeholders, by our advocates. So again, keep in mind, if you are open, and you know, we love to have like anywhere between 1 to 3 hosts or moderators. If you want to moderate one of those sessions, let us know. but that's what we can do. And we can still have film other kind of pieces around treatment and around treatment and care, even outside of the talks at the li with the library. We have a lot of leeway to do what we want, but it just is not going to take the form, at least right now, of in-person symposium or summit. Okay. So next here, so just talking about some of our past community conversations on cancer. The nice thing is that what we have done, we do have it online. If you go, we have a whole webinar library where we have a lot of the things we've done over the past few years available online for anybody to see. This one is a partnership that we did with one of our research programs, molecular imaging, right? So how do you actually image and see, identify cancers, right? Through those kind of visual means. That's what molecular imaging, part of what they do, right? So this was a series that we did with them that covered a lot of different areas in this topic, including radiation therapy. So again, and you can see all of our community members here, their pictures there, who helped to moderate these sessions. We're grateful to you all for doing that, and hopefully we can get more people in the mix. But again, go to the website, it's all up there. Similarly for outreach and education. Now, these actually are ones that were coordinated. I wanted to feature some of the ones in the past year or so that were coordinated by our cancer action councils. So navigating your cancer journey, that webinar was for Macomb County, right? The Macomb County Cancer Action Council. Navigation was one of their priorities and part of their something they worked on over the past year. And there's actually an on-site, I think it's going to come up later. We actually have something they created, an online resource to all the cancer navigations in all the cancer hospitals across the state, not just Karmanos, but all the hospitals that treat cancer across the state. So it's a great resource. Connor Creek did one Moving for a Cause where we did a presentation about cancer survivorship, and then we did a hustle class. There was this dance class attached to that. And then we actually have a Faith Community Research Network. We did a whole piece on family history and genetics, and cancer and outcomes, your health, your history, your healing. And that was with our Genomic Research Action Council and our Faith Community Research Network. Again, and then events with partners, we have that as well. So I want to acknowledge some of our community partners who may be on the call today, the National Council of Negro Women, the Gynecological Cancer Awareness Forum. That was actually just one of the second program that we partnered on with them. We did Empower with the International Myeloma Foundation. So that was a large scale program with that partner. And more recently, we worked with Cure for these educated patient updates, and it focused on metastatic breast cancer. That was just in December. So again, we're very open to doing partnering with other external organizations on community education events. So in thinking about responsive programs, we know that through our community, and we know through the data that poverty and financial struggle is something that is uh, prevalent throughout our catchment area. We do a lot of work on we're trying to do more work on the financial burden of cancer care. Some of you may be aware that we actually, for a number of years at Karmanos, we've had a legal advocacy for people with cancer clinic, the LAPC. It's a medical legal partnership between Wayne Law School, I should say, Wayne State University Law School and Karmanos Cancer Institute. It's existed since 2012, led by Kathy Smolinski. She's a former social worker and she's a lawyer. And she brings in students and others, and they work with cancer patients who need help and support with different issues. So between 2020 and 2023, they helped over 200 cancer patients on legal matters. And in 2025, we're going to be supporting them in taking some of these services to our more rural regions, either online or in person. So we're going to try to expand and move these services to other parts of the catchment area. So we're really excited about that. And they're going to be doing drop-in visits still in our cancer center and doing workshops. Actually, they just did a workshop, I believe, right? I think oh yeah, it was this one. Yeah, life planning. Yes, this is the last workshop. Life planning, understanding legal documents that can help you take care of yourself and your family. So we're going to continue to support that work through our Office of COE. COE, Community Outreach and Engagement. Also, I just want to acknowledge some of the work that many of our Cancer Action Council members were involved with. There was a subgroup that was an advisory board for Dr. Teresa Hastert, who you see there on the side. PSDER stands for Population Studies and disparities research. But they worked with her to create 5 webinars um, that talked about different elements of the financial costs and the burden of cancer care. But they also worked with her to create this amazing online resource called My Cost, Michigan Community Outreach to Address Financial Toxicity, right? So again, you go to my-cost.org. It's open to anyone. She just replatformed it, so it looks great. It's pretty easy to use. If you need help with housing, utilities, food, there's something there for that can be found there. It's captured there. And all the webinars are again in our webinar library. So again, this is just trying to share the work of this is what our office does. This is the responsibility of our office and our team. We do work on increasing HPV vaccine uptake. There's at least one way to prevent cancer, HPV vaccine, and we can vaccinate children at around age 11 or 12. You can actually do catch-up vaccines up to age 26, and you can prevent different types of HPV-related cancers. The most prevalent cancer used to be cervical cancer. Now the most common HPV-related cancer is oropharyngeal cancer, so of the mouth and the throat. That's now the leading HPV-related cancer, right? HPV, the human papillomavirus, is basically a sexually transmitted infection. But again, you can be vaccinated and be protected. So we've done research. Dr. Ariel Washington, who's one of our junior faculty members, has helped publish in this area because we've done focus groups in this area about uh, vaccine hesitancy or vaccine resistance. We created a whole video around this called Project ACE, Advocates for Cancer Education. We work with Western Wayne Family Health Centers with one of their docs who presented in the video to make the case for why it's important. We have or excuse me, I should say parents who talked about vaccinating their children. So you can see here Camille Hope Irvin and Joyce Crom, who talked about why it was important for them to vaccinate their children against HPV. So it's been interesting. It's something that we wanted parents to share with parents and have people. Um, it's meant to be that video is meant to be a community resource, like parents teaching other parents, community members teaching other community members. But things have evolved in a very interesting way. And actually, we're using it to train medical providers. So it's interesting. And we're doing that through McLaren Medical Group throughout the state, right? So again, Dr. Washington has been continuing this work in McLaren Medical Group clinics, 26 clinics that are in our north, central, and east and southeast regions. So if you look on this table here on the lower left, you can see where all the clinics are located. And then you can see this is from the state, or on the state level, the percentage or the proportion of males and females between the ages of 13 and 17 who have been vaccinated for HPV. These are very low, right? The goal is like 80% or higher, right? But here you can see it's 50% or 53% thereabouts and lower for both boys and girls, right? And again, you can see this again, what it looks like for the clinics that we are working with across the state. So Dr. Washington partnered with the American Cancer Society, and I know Megan Landry, I believe, is on the call. They've worked together, so I apologize for not acknowledging the American Cancer Society more like with a logo or something on this, but we collaborated with the American Cancer Society to train medical assistants and quality improvement specialists at these centers, and it's made a difference, at least in terms of people's knowledge, right? And they've been showing the video as part of that. So the video that was meant for parents, again, is being used to train and help support the medical providers. And I want to see, like, when we do these trainings, we ask questions before and after, right? In terms of what people know and understand in their beliefs. And I want you to pay attention to this. So you can see it here, right on this, near the bottom of the slide. We asked them before and after. I believe the HPV vaccine causes more benefit than harm, right? So you'd want people to respond positively to that, right? The vaccine causes more benefit than harm. Only 36% of people agreed with that statement. Again, these are not just the general public. These are people who work in medical settings. And afterwards, it only increased to 61%. So we still have more work to do, but at least it increased, right? And then the second one, I'm comfortable and confident with encouraging, supporting, and educating parents on the HPV vaccine. 50%, which again, we'd want to see it a lot higher, to 71%. So again, the work we do is hopefully making a difference because the recommendations come from the people you interact with at your doctor's office, right? Or your pediatrician's office, or your family doctor. So again, just an example of kind of the kind of work we're doing. Lung cancer screening is a huge, a newer screening, and it's a growing focus for us, trying to increase the number of people who are eligible to be screened for lung cancer. We actually were contracted by the Michigan Department of Health and Human Services to conduct listening sessions, first in Detroit, but then we got additional funding from from Karmanos, and now we were able to do listening sessions again across the state. And this was led by another one of our junior faculty, Dr. Kristen Mackey. And you can see throughout 2023 and 2024, we did these listening sessions that really we partnered with organizations and we identified people in the community and we heard what they had to say. And these are smokers and former smokers. We heard what they had to say about the messaging. What kind of messages do you need to hear about lung cancer screening? Because there's a lot of stigma around lung cancer, right? As you can imagine, because lung cancer for many people is something like it can be viewed by some as a cancer that you bring upon yourself, right? If you smoke, well, you shouldn't have smoked, right? Now you have cancer. Well, people might be less than sympathetic. But so there can be stigma for someone who smokes and someone who maybe has lung cancer. And that stigma can sometimes prevent people from getting screened for lung cancer. So we wanted to hear from people who are in that group, right? Those smokers and former smokers about what they thought about the messaging that we need to kind of create and disseminate to get more people to be screened. So, and you can see here in terms of what she found, people did not know. A lot of people don't know anything about lung cancer screening. There's concern about the costs related to diagnostics, right? Diagnosing and actually treating the cancer if it's found after the screening. And again, there's this avoidance, psychological avoidance, right, of cancer and screening because of fear and because of fatalism. Like, oh, okay, well, if I have it, there's nothing I can do about it, right? Or it's, what you don't know won't hurt you, that kind of attitude. So those are things we have to kind of work against in the work that we do, or fight against in the work that we do. An exciting area that we're growing in is crossing the digital divide. I mentioned that before. So technology assistance for cancer patients and caregivers is a emerging program that we're building here at Karmanos because we want to be able to support our cancer patients and caregivers, especially our older patients and caregivers. We want to give them support around technology so that they can find cancer information that they need, reliable, up-to-date cancer information, that they can use their patient portal if they want to, right? That they can go online, go to social media and connect with other people if that's what they want to do. So we have different partnerships. We have a community advisory board. Some of you are on that board and participating in that work. Blair, Katrina Studvant, who presented before, that's her organization. She's been working with a larger national group called the Patient Empowerment Network, if you see in the center, to deliver a program called the Digital Sherpa Program. And it's a kind of a program that again supports people in getting more confident and comfortable with going online and improving their digital skills. So, and we're building a whole research program around that as well. So that's something that we're building as well in partnership with the researchers, but also through our office. Okay. So before I go on, any questions, anything coming in the chat? Because
Yes,
I'm going to start,
there's
I'm going
one
to start
question.
winding down. Go ahead.
One of our attendees indicated that there was a report that was just released that says that lung cancer is growing in non-smokers. So their question is it because
Uh,
of pollution or can higher rates of these various cancers be attributed to where folks live?
yeah, I mean, I think that's a great question. I know that there's a lot of research going on in that area, but certainly I think that there's ongoing work around other types of environmental exposures, right, or pollutants, and how that might affect lung cancer. We know that radon is a kind of a gas that might be in your home, and there's a lot of you can find a lot out there about radon testing. Radon can increase your risk of lung cancer. So I think it's still to be determined, but I think absolutely there's a lot of work going on around that, which is why we want research to continue. But it stands to reason that those things could contribute to lung cancer. But I think that's a great point, and I think there's a lot that we don't know about that area. Right now, I would say the lung cancer screening guidelines are really tied to smokers, and right, it's really for smokers. But we also know that like firefighters are more at risk for lung cancer because of what they're exposed to and during the course of their work. So, all those things can be taken into consideration. And that might be something that, for different reasons, if you feel like you might be a candidate, even if you're not a smoker and you feel like though you might benefit from lung cancer screening, that's something you can discuss with your doctor. You can if you feel like it's relevant for you, that's something that you can explore. So I'm sorry, I don't have a better answer to that question, but it's likely. But right now, in terms of what we know for sure, it's limited. All right, scientific engagement capacity building. So this is how we kind of connect our communities and our scientists, right? And a lot of you have been involved with this. I already talked about our cancer action councils. Right now we have 8 of them. They're about 80 members across all the groups, but they're really a key part in making sure that we have direct connections with community members and their perspectives. Everybody, all of our Cancer Action Council members have gone through a process. They've been trained in research through the Building Your Capacity curriculum. We've identified priorities and research questions through concept mapping, and we've shared this out with our cancer. We certainly share it with our Cancer Center members and with the community at large. I want to share just some of the accomplishments here. Connor Creek right now has words of wisdom on caregiving. Um, that actually we share and disseminate through we have an educational resource center in the hospital. So we just ordered 200 more copies so that we can disseminate and share it with our patients and anybody who wants to have it. And it's really a really fantastic resource and lets you know that you're not alone. Right? Other people are going through what you've been through as a caregiver. Western Wayne actually now has a partnership with Wayne State University's genetic counseling program because they're interested in helping people collect really more accurate family histories that can be important for cancer, for understanding your cancer risk. So that's really exciting. And we have our director of genetic counseling and students coming to those meetings. And they're also creating an educational outreach program to address cancer risk in families and working with Western Wayne Family Health Centers, that's where they're based, to kind of support and train physicians on how to get better cancer family histories, right? Or family histories of cancer. Our rural Michigan Cancer Action Council has been developing a transportation resource. Transportation to healthcare, like many other parts of the states, but particularly in rural areas, it's really pronounced, the lack of transportation, reliable transportation. So that actually hopefully will evolve into a policy issue that we can work on with them. Macomb County, as I mentioned, worked on reviewing all the cancer navigation programs in the state of Michigan. You can find that on our website as well. Black Men's Council has done a couple of programs. The most recent one focused on prostate cancer awareness and training people in the community, what we call lay health advisors, lay people, to teach other folks about prostate cancer. So that people were trained during that event, and we're going to continue to train people to share this information with others in the community about prostate cancer screening. Genesee County in the fall had a great presentation looking at the relationship between food and diet and nutrition and food, environment, and nutrition on cancer risk. And we had a really great nutritionist who was who spoke and really provided outstanding information. And that's on our webinar library, right? Michaela, yep. So you can find that there on our webinar library. We try to capture as much as we can. Oakland County Cancer Action Council collaborated with one of our faculty members, Dr. Carrie Leach, on a Chromebook guide for older adults on how to use your Chromebook and how to use your laptop for people who might need more support. They work with another faculty member, Susan Egley, on the ASQ, right? So that's actually ask questions. It's what we call a question prompt list. This is a list that if you're diagnosed with cancer and you have recommendations for cancer treatment, you can take this list of questions to ask your doctor so you can make sure that you're getting all the information you need about your treatment. So Oakland County worked with her on that tool as well and gave feedback on that tool. So this is really incredible work, really. And then I want to acknowledge Access Dearborn Cancer Action Council. Their work helped support an abstract that was presented at a NCI, National Cancer Institute Symposium, because they were part of a whole project that we did on financial toxicity, financial burden of care in the Arab American community. I was scared of money, early findings of a qualitative study on the experience of financial toxicity among Arab Americans. And one of our team members, Ali Faki, who I think is on the call, he made that presentation there. And they just wrapped up a project with Dr. Jennifer B. Dimmer, looking at really trying to build an inclusive, community engaged program for Arab American women around physical activity. And that was using Dr. B. Dimmer works on it's going to come up later, a program called Capable, which is high intensity interval training. First, it was focusing on cancer survivors, and now it includes people at high risk for cancer who may be at high risk for cancer. So we had 17 women participate in that. It was really extremely successful. I mentioned the Building Your Capacity curriculum. We're offering again this year. We're setting the dates. We're going to offer it to anyone in the community who wants to take it, so you can get an introduction to research. Building Your Capacity curriculum, because we offer it online. People across the country have been taking it. at other cancer centers and with other projects. So we're trying to grow this. Dr. Rhonda Daly, one of our colleagues, is going to be teaching it, and we're going to offer it 3 times for during 2025. So look out for that. Our Community Health Scholars Program. If you like the introduction to research, you can go more, you can take a deeper dive through our Community Health Scholars Program. The course is called Building and Applying Research Skills. So we're going to be offering that starting in May this year. I'm going to be teaching it directly. It's in person. It's like a college course. So you're going to work with me and go through this. So, again, if you want to learn more about research and become more skilled in conducting your own research or becoming stronger as a collaborator, a consultant, or a community co-investigator, come on board. Reach out. We'll send all the information about all that soon. And we've trained about 25 community health scholars to date. So again, it's a program that we're really proud to grow. We're also not only focused on community members, we're training our faculty, our scientists. That's really important. We have the Scientists in Action program. So we're teaching our scientists and our oncologists how to communicate more effectively and clearly and simply with our community members and patients. So they go through a video that helps them communicate their science more effectively to lay audiences, people who may not have a lot of scientific background. We've trained about 44 of our researchers and 6 graduate students so far, 81% increase. We saw an 81% increase in the proportion of our participants who said their knowledge was enhanced. We saw a 61% increase in the proportion of participants who reported that their confidence in talking to community members was enhanced. So we're seeing increases, we're seeing impact. So that's good to see. And I know some of you have been involved with giving direct feedback to some of these folks who are creating talks and presentations. And we hope that all of you in the call will continue to be a part of that because, again, we're growing these programs, not only in our cancer center, but across our university with scientists with all different backgrounds, right? Whether it be diabetes or dementia, we're growing this. So we hope that you will be on hand to provide feedback to those scientists and their presentations. We've done a lot of things in precision oncology. I'm not going to go through this in a lot of detail, but precision oncology really is kind of the use of, genetics and genomics and really personalizing medical care and personalizing cancer care. Right? And a lot of our researchers here. At Karmanos, I've been doing a lot in immunotherapy. How do you use your immune system and kind of use the immune system to fight cancer? So we've really been trying to do a lot in communicating and teaching people about what we call precision oncology, this new approach to treating cancer. We worked with our churches. Remember, I mentioned we had a faith community research network and a genomic research action council, and we created a program called The Future of Medicine is Now that talked more about these areas. And we saw like some really from pre-test to post-test, from before the program, after the program, saw some uh, really positive changes in knowledge and attitudes around clinical trials and precision medicine. So we actually are updating our video that we have. We used to have a video called Facts about Cancer Clinical Trials, and we're using everything we learned to update it. Now it's called Understanding Research and Clinical Trials as Part of Your Cancer Care. And we're including more about precision oncology and immunotherapy in that video. And remember how I talked about we're using the HPV video to train medical providers. Well, now we're going to be using our clinical trials video to train people who work in our clinical trials office, the people who help to implement and monitor our clinical trials. So that's something we're looking forward to as well. And I also want to talk about just, in terms of scientific engagement, I just really want to really highlight the work of our LGBTQ Cancer Action Council, right, which has existed since, the early days, 2018 or so. And this is a timeline since, 2017. Since 2017 to 2024, this group has worked with a number of our researchers and really done just incredible work, starting with 2017 getting external grants to move the work forward. 2018, we got funding from the DMC Foundation to do more work in one of their priorities, cancer caregiving in LGBTQ communities. We conducted research to investigate and go more deeply into that topic. And as you can see, by 2022, 2023, 2024, we are doing poster presentations at conferences. We have about 3 publications coming out of this work. And one of our investigators, our scientist, Dr. Teresa Hastert, works with one of our colleagues at University of Rochester, Dr. Charles Kamen, and they have NCI funded work on adapting the FOCUS program. That's an existing program program on cancer caregiving to support cancer caregivers and the people they care for sexual and gender minority cancer patients and caregivers, right? So um, just an example of just the importance of the partnerships and how we try to really, as a COE office, support partnerships between community members and our scientists. Now, moving that forward, we have increasing community engagement. We have in terms of increasing our community engagement in our science, we have a new program, the Advancing Community Engagement in Science, or the ACES Small Grants Program. The first recipient is Dr. Michael Wilson here at our Cancer Center, who studies the role of obesity in endometrial or that's a type of uterine cancer. And we have provided him with a 4-member community advisory board who they're going to be providing him feedback on his work to kind of think about maybe areas related to obesity that might be useful here for him to include in his work. They're going to give him advise him on some of his abstracts and the summaries of his work. Sometimes when you're writing grants, the funder wants to see what they call a lay abstract or something, a community abstract that anyone can understand, right? So this group is going to be giving feedback to make sure that his work is really easy to understand by a broad audience. And they're also going to support him in preparing a talk for the broader community. So we're really excited about this and where this is taking because they're doing a lot of really good work together so far. And some of you have been involved in our research advisor program. We're actually going to assign community advisors to our 3 research programs at Karmanos. So we have 17 members, and they've all been assigned to one of the 3 groups: molecular imaging, I mentioned them before, tumor biology and microenvironment, and population studies and disparities research. Each of the advisors is going to get like a scientist buddy, and you're going to get paired up, and you're going to learn more about their work. You're going to come to our research program meetings, and help plan the retreats. You're going to get very involved and embedded in these research programs. So again, that's how we kind of again are trying to build these connections. All right. Any questions there? I know I have about maybe I'm gonna finish this out in 5 minutes. I have 8 slides. I'm gonna move quickly. How you all, because I want to make sure we answer all questions. Any questions yet? Any questions there?
No questions at this time, Haley.
Okay. So I wanted to take time. We're doing the broad view. You're seeing everything, just almost everything we're doing right now. So I want you, because I want everybody to know what we're doing, why we're prioritizing what we prioritize, and the ways you can kind of stay involved, get involved if you haven't been involved before. We want you to stay connected to us. Cancer prevention screening, connection to care. This has really evolved since I became director for community outreach and engagement, and we're doing so much more in this area. We have Karmanos Academy. That's where we're training people, lay health advisors, to teach others in the community about breast cancer. We have the prostate cancer one is launching. We're hopefully going to launch the lung cancer screening one too. So we try to make it easy for all of you to teach other people in your networks about cancer screening and cancer risk factors. So far with our Real Talk, we call it Real Talk. Because we did this in the past and we were reviving this. So it was called Real Talk in the past. Real Talk since April 2024, we trained 36 community members, LHAs, we call them, lay health advisors, 36 members. So you can see here we're growing, but you can see how it will build from going from left to right. We've done 19 programs. We've reached 353 women. It's been mostly women. They're Yeah, predominantly women. We found 61 women who are off schedule for the mammograms, right? So that's important. In those, we found 22 women who need a diagnostic mammogram. That means they're having a symptom, their problem. There's a lump, a bump, a pain, there's a secretion, something, and they need to get a mammogram. We found 141 women who might be eligible for genetic risk assessment, genetic counseling, or genetic testing because of their family history. We found, and we've navigated so far 51 women. So we actually, in our office, we either navigate women to care, make sure they're connected to care, or send them to our Karmanos hospital navigators, and they help them get scheduled with care. Right. And so far, we've completed 3 diagnostic mammograms, again, for the women who had problems or symptoms. We've completed 12 screening mammograms, and we've had 3 genetic counseling visits completed. But you see the issue here. The outreach is to make sure ultimately we connect people to care. That is our focus. And it takes a lot. It is a lot of work to do that. Now we have funding from the NCI to expand what we're doing to Middle Eastern, North African communities, our Arab American communities. And so we're growing this particular Real Talk breast cancer in this way. Like I said, we have Real Talk prostate cancer. We have 8 people trained, 2 sessions scheduled so far. Hopefully that will grow. And we are also doing community care. That's our lung cancer screening program that's coming soon. But we do some of this work, but we also have other entities in Karmanos and McLaren that are also doing outreach. So, we have throughout all our hospitals, throughout the whole network, Between 2021 and 2024, you can see we had 200 events reaching almost 15,000 people. The Tri-County Breast and Cervical Cancer Control Program, the BCCC program that helps women living below poverty get care, they are actually housed within Karmanos, right? And Karmanos provides their infrastructure. So you can see they're reaching thousands of women, and as well as our hospital navigators. They're also reaching thousands of folks as well. And then I want to say that we actually are, through our budget, through our expanded budget, remember I told you it's been increased. We finally have a workable budget. We are actually contracting with some of our community-based organizations throughout the state so that they can provide us with community navigators to do outreach and connection to care in their region. So we're working. I don't want to say who they are because we're still signing off. I know Maida's like, don't say who they are yet, but we're trying to sign the paperwork. So you can see we're up north, we are in central Michigan, we're in the east, as well as kind of further up in I will say Pontiac, right? Yeah, I have it there, Pontiac. So you can see we're doing this work not only in the city, but all throughout the state and partnering with people to make it happen, the right folks to make it happen. Partnerships and policy, I've just talked, we have a whole research and advocacy consortium, 45 organizations partner with us statewide. So you can see that there. I'm not going to go a whole lot into this, but again, this is what makes it possible for us to kind of to set up these partnerships and do more outreach and do more connection to care. I'll share a little bit more about collaborations with Michigan Department of Health and Human Services. We actually help lead, well, the Michigan MDHHS sponsors something called the Michigan Cancer Consortium, which is a whole consortium or network of organizations and hospitals across the state working towards um, the state's cancer control plan. You can go online. Michigan has a whole cancer control plan that you can see, and you can see some of the goals and the objectives around cancer risk factors and cancer incidence and mortality. You can find it all in that plan. And so one of the objectives in the cancer control plan was increasing physical activity among cancer survivors. So again, you can see Dr. Beeb Dimmer here, and her program Capable. That's that high intensity, a high impact, high intensity training program, HIT program for cancer survivors. It's something she's been doing again across the state. And she was able to do this with some support and input from Michigan Cancer Consortium. So it's something that we're still trying to promote as we move forward. I mentioned that we just recently did this in Dearborn Heights with 17 Arab American breast cancer survivors and high-risk women. It was extremely successful. I mean, it's 3 times a week, right? And most of the women came all the time, every single session, and really built bonds and it improved their strength and their functioning. So this is again, physical activity is cancer prevention. So it's something we want to again continue to expand. We work with young cancer survivors. We have a whole young cancer survivor cancer action council, and that is also in partnership with Michigan Department of Health and Human Services, and they get funds from the CDC, and that and then they contract with us to do work in our area in our region around young survivorship. So we sponsored the Young Breast Cancer Symposium in 2023. We just had our council just did a whole webinar that I believe you can find online around long-term survivorship with adolescent and young adult survivors. So this is an area that's a priority for us as well. So, and right now they're creating a whole online information hub for young survivors. So they're doing really exciting work. And in future directions, we want to do a population health assessment to get some more data from community members directly around cancer behaviors and risk factors and concerns and needs. Want to do more in the area of advocacy and policy. I've talked about transportation as one area for advocacy and policy. The digital divide is another area. And then expansion. We did some advocacy this at top of this when we talked about the federal indirect cost rates. And we just want to continue to expand all of our programs all across the state. So that's it. Thank you. I'm going to end my
Question.
slideshow.